Praise the Lord. First of all, I would like to thank each one of you for joining this COVID awareness program. I feel great proud to say that this program has been organized by the PYPA-IPC Bethel T Dasarahalli. And I would like to thank Dr. Suzi for accepting this invitation and taking your valuable time to join with us. As we all know, the current situation where the virus is spreading and people are rushing to hospital for treatment. But unfortunately, there are no beds and oxygen tanks to be provided. So it is time to take necessary precautions so that we can help the doctor and nurse to do their work peacefully and also take care of our health as a home remedy. So with no further ado, let's begin this meeting with a word of prayer. And I would like to request Binu to please pray for the blessing of this meeting.
Lord Father, after Sunday worship, Lord Father, we are here for the discussion thing, Lord Father. We present your hands, Lord Father, as we see, Lord Father, the virus, Lord Father, is spreading a lot, Lord Father, but we have no beds, we have less of equipment, Lord Father, but Lord Father, we pray, Lord Father, to guide Dr. Suzi, Lord Father, to give us valuable precautions, valuable preventive measures, Lord Father. Let us, Lord Father, to listen to those with an open heart, with an open ear, Lord Father, and work according to your Lord Father. Lord Father, we thank you, Lord Father, for bringing Dr. Suzi, Lord Father, in the midst of us, Lord Father. Lord Father, we thank you, Lord Father, for giving her a heart, Lord Father, to take out some time for us, Lord Father. Submit everything into your hands, Lord Father. Submit the proceedings into your hands, Father. Give us, Lord Father, preventive measures, Lord Father, through her, Lord Father. Submit everything into your hands. Thank you, Lord, for everything. Thank you, Lord, for bringing us together, Father, to the technology, O Lord, Father. Help us, Lord, Father, to follow those precautions, follow those preventive measures, Lord, Father. Submit everything into your hands. Thank you, Lord, Father, for listening to our small prayer. In Jesus' name, pray.
Thank you, Binu. So we'll begin this meeting. So first we'll be having a presentation by Steffi. So I would like to request Steffi to take this forward.
Praise the Lord. Am I audible?
Yes, yes.
Okay. Good evening, everyone. This is Steffi Matthew. I'm here to show a small representation or a small view on the pandemic that we're facing all around. Hope this presentation will help you to prevent or to overcome the challenges that we're facing on a day-to-day life nowadays. I request Jen to help me with the slide. So let me just begin with what is COVID-19. COVID-19 is a disease caused by a new coronavirus called SARS-CoV-2. So the next, I would like to go on to the symptoms of COVID-19 that most of us have seen or most of us know about the symptoms, but I would like to share most common symptoms of COVID-19. So that is fever, dry cough, fatigue. Other symptoms that are less common and may affect some patients include loss of taste or smell, nasal congestion, conjunctivitis, sore throat, headache, muscle or joint pain, different type of skin rash, nausea, vomiting, diarrhea, chills or dizziness. So now I would like to turn your attention to some severe COVID disease symptoms. So that will include shortness of breath, loss of appetite, confusion, persistent pain or pressure in the chest, high temperature. So I would like to also cover the other less common symptoms which are severe. So that will include irritability, confusion, reduced consciousness, depression, anxiety, sleep disorders, more severe and rare neurological complications such as strokes, brain inflammation, and nerve damage. So let us now know how it is transmitted. I'm sure most of us know or we have the knowledge of this, but I would like to cover some of the topics on how it is getting transmitted. So people can catch COVID-19 from others who have the virus. The disease can spread from person to person through small droplets from the nose or mouth, which is spread when a person with COVID-19 coughs or exhales. These droplets land on objects and surfaces around the person. Other people then catch COVID-19 by touching these objects or surfaces and then touching their eyes, nose, or mouth. People can also catch COVID-19 if they breathe in droplets from a person with COVID-19 who coughs out or exhales droplets. So now, since we got to know how it gets transmitted, we will now know what happens to the people when we get attacked by this virus, or how will be the body condition. So what happens to the people who get COVID-19? Among those who develop symptoms, for about 80% recover from the disease without needing hospital treatment, but about 15% become seriously ill and will require oxygen, and 5% become critically ill and need intensive care. Complications leading to death may include a respiratory failure, acute respiratory distress syndrome, sepsis, and septic shocks. This will also include the injury of the heart, liver, and kidney as well. In rare situations, children can also develop a severe inflammatory syndrome a few weeks after infection. So now we will have a small look through on when do we get a test done for COVID-19. Anyone with these symptoms should be tested wherever possible. People who do not have symptoms but have had close contact with someone who is or may be infected may also consider testing. While a person is waiting for testing, from others. So now I would like to pick up the two important words which we have mostly used in the year 2020 and 2021. One would be isolation and the other one would be quarantine. So let us know what is difference between isolation and quarantine. Both isolation and quarantine are methods of preventing the spread of COVID-19. Quarantine is used for anyone who is a contact of someone infected with COVID-19 virus, which causes the disease, whether the infected person has symptoms or not. Quarantine means that you may remain separated from others because you have been exposed to the virus and you may be infected or can take place in a designated facility or at home. For COVID-19 treatments, this means staying in the facility or at home for 14 days. Isolation is used for people with COVID-19 symptoms or who have tested positive for the virus. Being in isolation means being separated from other people, ideally in a medical facility where you can receive a clinical care. If you are infected and do not develop symptoms, you should still remain in isolation for 10 days from the time you test. So now, since we got to know what is quarantine and isolation, let's know on how long the symptoms may develop, or how long we should be in quarantine or in isolation. And this also explains why we should be on a time period of 1 to 14 days as well. So how long does it take to develop a symptom? The time from exposure to COVID-19 to the moment when symptoms begin is, on average, 5 to 6 days and can range up from 1 to 14 days. This is why people who have been exposed to the virus are advised to remain at home and stay away from others for 14 days in order to prevent the spread of the virus, especially where testing is not easily available. So let us now turn our attention to the areas where we have to prioritize for disinfection, or areas we have to be careful so that the virus do not spread over. The disinfection practices are important to reduce the potential for COVID-19 virus contamination in non-healthcare settings, such as in the home, office, schools, gyms, publicly accessible buildings, faith-based community centers, markets, transportation, and business settings or restaurants. High-touch surfaces in these non-healthcare settings should be identified for priority disinfection, such as door and window handles, kitchen and food preparation areas, countertops, bathroom surfaces, toilets and taps, touchscreen personal devices, personal computer keyboards, and work surfaces. So now we have also heard about mutants and variants. So let's have a small idea of what does it really mean when they say a virus mutates or a variant or changes. So when a virus replicates or makes copies of itself, it sometimes changes a little bit. These changes are called mutations. A virus with one or several mutations is referred as a variant or original virus. The more viruses circulate, the more they may change. These changes can occasionally result in a virus variant that is better adapted to its environment compared to the original virus. This process of changing and selection of successful variants is called virus evolution. So let us stop the spread of the virus. Let us prevent ourselves. Let us safeguard ourselves. So here are very few steps that we can follow and which we can avoid or which we can prevent. So one of that will be getting the vaccine once it's available, washing your hands very frequently, keeping at least 1 arm distance from others, wearing a mask. Hope this has helped everyone. Thank you, everyone. God bless you all. Over to Jerry.
Thank you, Steffi, for the beautiful presentation. I hope everyone could understand how the COVID and the precautions that we need to take. So we got around 23 questions for Dr. Susi. First of all, I would like to take this opportunity to welcome Dr. Suzi. Dr. Susi is a diabetologist and consultant internal medicine at Vikram Hospital, Bangalore. She's here to resolve our queries on this pandemic. So thank you, doctor, for this time. We have about 23 questions in our link, which we have provided yesterday in the group. So Dr. Suzi, if you want to introduce or if you want to say anything to the audience, please feel free. Yeah.
Okay, thank you for inviting me to this meet. So it's a wonderful moment, I would say, because this is the right way to spread the word about COVID, the most deadliest thought in everyone's mind at the moment. But taking through few precautionary measures, I think we can handle this. But what has to be done in the right way. And I think as we go on with the questions, I'll clarify all your queries. And if there's anything else apart from that, I will talk to you again after that. And before that, I would like to thank Brother Binu for having prayed for me. I think that's what has been taking me all this while and keeping me safe. I've been kind of seeing almost hundreds of COVID patients every day. And it's nothing but the grace of God keeping me going. So thank you so much. Jaren, we can start the session.
Thank you, Dr. Susi. So the first question is, I don't have much symptoms except for problems in smelling and tasting. For how long do I need to isolate myself? What are the precautions to be taken?
Yeah. So talking about symptoms, I think Sister Steffi did a good job by telling us what the symptoms are likely to be. To begin with, the first 2 to 3 days, you may not have much symptoms until and unless it's an elderly person or a person who's having multiple medical problems like diabetes or blood pressure. They usually don't have any symptoms. But if you start to have any symptoms like body pain or loss of smell, loss of taste, these are very classic of any viral infection, especially the loss of smell. is as good as getting a positive COVID report. So when someone tells I have a loss of smell, it means you have 99.9% chances that you have a COVID infection. So with these mild symptoms, maybe the second day, I would say, rather than the first day of your symptoms, go and get your test done. Because if you get your test done on day one, probably, for example, you have your symptoms today morning and today evening you go with your test done, it's likely to be negative because the virus is still building up. So your test is likely to be negative. So you wait at least for 48 hours. 48 hours, get the test done, and then we'll guide you what has to be done beyond that. But until then, if you have any fever or any sore throat, you just do some home remedies, take some paracetamol and gargle your throat. And I don't think you should worry much about it, at least for 48 hours until you get the testing done.
Thank you, doctor. Next question. Can Ayurveda, homeopathy, and naturopathy save from COVID? Is it scientifically proven that steam works against COVID? Can change of diet work against COVID?
Well, Ayurveda, homeopathy, naturopathy. Any treatment that gets you better is what all of us want. Now, no one's working towards which medicine is getting better, whether it's Ayurveda or homeopathy. What I would suggest at the moment is naturopathy, which is what we get it in hospitals. You need to go to the hospitals. We give you certain medicines because any antiviral medication, which is a naturopathy medicine, has to be started within the first 3 to 4 days. That's when the medicine is effective. And now what we're seeing is majority come after the 5th, 6th day because 2 to 3 days you are likely to wait for the test. And if you're getting it done through the government, it takes another 48 hours. And then you think, okay, maybe I'm getting better and wait for another day. And finally you land up with us on the 7th day, which is very late for us to treat you. Whereas talking about Ayurvedic and homeopathy, no one's really worked on the interactions between these different traditions of medications. But I think they're all natural medicines, majority of them, the homeopathy. They should probably be building up your immune system. So I don't think you should worry much about it. But for the moment, you need to go for a medicine which is going to revert back your infection or fight against it at the earliest.
Thank you, doctor. What are the dietary food items we can consume to boost respiratory health?
That's a very good question because everyone is targeting at a natural cure. So I would always recommend a good homemade food, which is definitely going to be nutritious. Apart from that, a lot of vegetables and fruits and hydration. You need to take in at least 2 to 2.5 liters of water a day. Apart from that, vitamin C rich foods. Vitamin C always helps you fight against any flu-like symptoms. So I would suggest vitamin C rich foods, which are nothing but your citrus fruits.
Thank you, doctor. Is coronavirus effective on children and youth as well?
Youth, yes, definitely. Because they come with symptoms, they get themselves tested positive, and the treatment is the same as for any adult. Talking about children, which every parent is worried about. Any child less than 12 years, what we do when the kid comes with fever, cold, or cough, we do not test them. Why? Because even if they test positive, we do not give any particular specific medicine for COVID as such. We treat them just like any other simple cold and cough, which your pediatrician will guide you about. So if you're worried, I have COVID and what if my child also gets it because of me? I don't think you should worry about it. Even if the child gets it, the child's immune system is pretty good enough to fight against it.
Thank you, doctor. Should we refrain from sexual intercourse during the pandemic?
Sexual intercourse, well, it's the most divine and intimate way of expressing your love. 2 reasons why you need to have sexual intercourse is one, because it releases feel-good hormones called endorphins, and that itself de-stresses you. A period where all of us are stressed out, and of course, the couples are worried about it. So sexual intercourse should not be a problem. But if one of the partners have any symptoms, then they should stay away from it because COVID spreads through droplets. And I think at that point of time, you should stay away from it.
Thank you, doctor. Does COVID spread through? We have the same question, so we'll move on to the next question. Can mothers who recover from COVID breastfeed?
Yes, definitely they can, because when they breastfeed, the breast milk definitely has some amount of antibodies formed because of the COVID infection. indirectly they would be giving the antibodies to the child as well. So 100% yes, they can breastfeed the child.
Next question. Is it okay to get pregnant during this time? Are there risk if a pregnant woman contracts COVID during one on her visits to hospital for checkup?
That's a little difficult question. Why? Because there will be many people planning for pregnancies or already are pregnant. Those who are pregnant, don't worry. Every doctor is making sure you're safe and your baby is also safe. But when you're coming to a hospital, I think most of the pregnant mothers would prefer going to a place where there are no COVID patients. I think that's a very good thought. You should behave that way. The second thing is, whenever you're going to a hospital and there are other COVID infected patients around, or you're going to a hospital where there are a lot of other COVID patients, what happens is there are all possibilities that you can get the virus. And if you are down with COVID, we treat you very, very symptomatically. And specific treatment is applied only if your symptoms worsen. So we have treated a couple of patients who are pregnant and had COVID infections. They have delivered very safely, the baby is fine, and mothers have recovered very well. So I think it's quite safe to be pregnant. But if you're planning, I would say you just wait for a few more months until the pandemic is over, for the only reason because there is a lot of restrictions around, which may not keep you comfortable. It's about the stress levels that I'm talking about when I'm saying that you may not be comfortable. Otherwise, there's no harm and there is no worry that you should not get pregnant.
Thank you, doctor. Can a person who has COVID drink wine moderately?
I think the answer is the question: moderate intake of wine. So everywhere, most of them think wine de-stresses you, and what happens is you cross the limit while you de-stress yourself. So if you ask me, my personal opinion, it's always a no to alcohol. And of course, if you take it, it is in moderation, definitely. So we recommend 14 units of alcohol per week, and I think you bring it down to 10 a week. That would be the best thing.
Does the sugar in soft drinks become dangerous and make us vulnerable to COVID?
Sugar, I think of late has been spoken about as a cancer causing substance. Well, sugar is just like any other ingredient in your food. Normally, we recommend about 4 to 5 teaspoons a day for every normal individual. But if you're worried about it, especially if you're a diabetic, then we ask you to reduce as much as possible. Definitely, sugar has got nothing to do with COVID.
Thank you, doctor. What kind of diet should a diabetic patient follow?
I keep it very simple, because if you tell a diabetic person not to eat this, not to eat that, they're definitely going to be dreaming about that the whole night and, barge into the kitchen and the store and eat everything possible. So keep it very simple. Try to avoid 4 white ingredients. Number 1, white flour, which is your maida products. That includes all your bakery products and parotas and other stuffs. Second white stuff is going to be a white sugar. So white sugar is basically, we avoid, not stop, we avoid because it increases your blood sugars. Third white stuff is your white salt. Again, no stopping, avoiding. So try and limit your intake of salt because that causes a lot of water retention in the body. And the last one is your white rice. So white rice, we're all born and brought up, being South Indians, to eat a lot of white rice in everything that we eat, our idlis, dosas, and white rice, whatever it is. So white rice basically is high in glycemic index. So it increases the blood sugars very high in a very short span of time, post which the sugars dip very badly, because of which they feel very tired. So what I recommend is avoid your white rice, rather go in for your red rice or brown rice, which has a low glycemic index, which means it will not increase the sugars very high. It has a kind of a plateaued response to the blood sugars. So avoid white rice, white sugar, white salt, and your white flour. And the rest would be lots of vegetables and fruits in moderation. I don't say don't eat this fruit and that fruit. I always say eat all fruits, but in moderation, and take your fruits only as a snack and not with your meal.
Thank you, doctor. How to know if I have contracted COVID, though there are no symptoms?
Without symptoms, it's very difficult. So that's where the quarantine and the isolation comes into play. If you have exposed yourself to a person who's positive, then you're quarantined, we say at least for a week's time. So 7 days. And if you develop any symptoms, that's where we ask you to test, because that's when we know that probably you have the COVID infection. Of course, there is a percentage of healthy individuals where they would have had the infection without any symptoms and they just recover on their own. For example, I had a nurse in my hospital who just wanted to get her antibodies tested to see if she's got the infection at any point of time. And her antibodies were wonderful, which means she had the infection, she's recovered, and she's doing really great without any symptoms. So there's all possibility that you can have the infection, but you may be asymptomatic, where you can do nothing about it.
Thank you, doctor. What is the best home remedy for COVID?
Home remedies, I'm not sure if this is going to help, but I will give my best. Lots of liquids, like I already have mentioned, and vitamin C rich foods. Eat on time, avoid oily stuffs, and I think staying healthy with a good pattern of exercise is the key here. And talking about the elders with diabetes, blood pressure, heart problems, especially asthmatics, what you need to concentrate on is a good breathing exercise, because you're kind of strengthening your lungs, and which in turn is going to fight against the infection.
Thank you, doctor. Next question. I am a male and have a belly fat. My friend told me that people with belly fat are the ones who are dying due to corona. Is it true? Can belly fat be dangerous during corona?
Well, that's a nice question. So belly fat is always a big no to everyone. So what it basically tells you is the unhealthy lifestyle, a belly fat. So targeting at losing your belly fat is going to take a few months. And by then, I think the pandemic will get over. So those who have a belly fat, start exercising. Better late than never. So what it means is obesity. A belly fat means obesity. Obesity is a risk factor for any kind of medical issues. And we have definitely seen people who are obese having a little extra time to recover compared to the normal individuals with a normal weight.
Thank you, doctor. Is a rapid test effective? My friend did a rapid test and it came negative, but after a few days, he was having some symptoms like throat pain and breathing problem.
Initially, like I said, when we used to ask the patients to get tested as soon as they have symptoms, we did get a lot of positive cases, like the test would turn out positive, but this was last year. In the last few weeks, probably in the last 4 weeks, I would say, I'm seeing patients coming with a negative report in the first 3 to 4 days, even with symptoms. Probably it's a different strain which is not getting picked up in the tests. But 2 reasons why you need to get a rapid test. Number one, if you have symptoms, probably on the day 3 or day 4 of your symptom, the viral load is pretty good enough for just a rapid test to pick it up. Okay, basically it's an antigen test. Talking about the other test, which is your RT-PCR test, it's a confirmatory test which we do after the rapid test if it is negative. So rapid test is good to get it done in the first 3 or 4 days of your symptoms. And the second reason why we want a rapid test is we get the test results in 2 minutes. The moment I know the patient is positive, I can start the treatment right away. Whereas RT-PCR takes at least 24 to 48 hours for us to get the report. So in COVID treatment, time is very important for us. It's very precious. So every second matters. So I think it's safe to go for a rapid test, especially if you are symptomatic. But if you're asymptomatic, I would not recommend a rapid test. Rather, I would recommend a RT-PCR test. And I'm sure that is only for some purpose, like a travel purpose or exam purpose. Else we don't recommend any tests simply.
Thank you, doctor. What are the medicines and precautions that needs to be taken if there are no beds and oxygen at hospital?
The best way is to just pray to God. That's first and most important thing I would ask you to do, because none other than Him is going to help us out of this. Talking about home remedies, there's nothing much you can do if you're sick and you need hospitalization. So what we have seen is people coming in with low oxygen levels on the 5th or the 7th day of your infection. The moment you have a very low oxygen level, it means the virus has already got into your lungs and damaged the lungs. So at that point of time, it is too late for us to treat you with any antiviral medication. And what you need is probably some steroids to bring down the swelling in the lungs, which we call it as inflammation. So and steroids, you don't get it as an over-the-counter medication. You have to meet your doctor. So if you think there is a need for you to be in the hospital and there is no bed, as doctors, we're doing our best to help you treat at home itself with medications. So meet your family physicians, and I think they will give you the best treatment, whatever it is and wherever you may be.
Doctor, what are the kinds of food we need to consume to stay healthy in these times?
Well, I think it's a repeat again. So healthy foods, like nutritious foods, balanced diet is what I would say. Eat a lot of green leafy vegetables, vitamin C rich foods. I want to stress again on that. Vitamin C prevents your flu-like symptoms, and with hydration, 2 to 2.5 liters of water, or 2 to 2.5 liters of water with juices and soups made at home. That also is equally good.
Thank you, doctor. Are vaccines effective? Is it mandatory to take them?
Yes, vaccines have been there since ages. And the only reason we give vaccines is to make sure we don't have a huge mortality, which means a huge death rate. Any vaccine you take protects you for about 40 to 50%. And a remaining 50 to 60% chance is always there you get the infection. So, for example, we all have taken our BCG vaccines at the time of birth. So have we seen people not landing up with tuberculosis in our country? No, we still have tuberculosis. So BCG vaccine does protect us, but not 100%. Same way, a COVID vaccine does not give you 100% protection, but a 40 to 50% chance that you may not get it, and a 50 to 60% chance that you may get it. So we do not know which block we belong to. Is it the 40% who won't get it, or the 60% who gets it? But what we have seen in this the second wave of the pandemic, is people who have taken vaccines definitely have not landed up in the ICU. The severity of the infection is much, much lesser, and we have been able to handle them in the outpatient department itself. So that's a very positive thing. And I recommend everyone to take the vaccine. And it's very nice of the government that from May 1st, 18 plus, all of you are eligible to take the vaccine. You all have to get vaccinated.
Thank you, doctor. I hear people say that they got fever, body ache, and pain in their hand after vaccination. Is it true? If yes, why so? And should I be concerned?
Yes, that's very true. What happens is, whenever there's an injection given, I'm not just talking about the vaccine, it's an injection that's given, the muscle where the injection is given becomes a little sore. And because of that, you tend to have a little bit of pain. And because of the pain, you feel the limb is a little heavy. So I'm sure it's not lasted beyond 24 hours or maybe 48 hours. So just a simple paracetamol will help you get better with it. There's nothing you need to worry about it.
Thank you, doctor. Is it safe to get vaccinated during menstruation?
Yes, it's very safe. Menstruation and vaccination have got nothing to do with each other. So any woman who's menstruating can take the vaccines with no issues at all.
Thank you, doctor. What are the precautions that needs to be taken post-COVID recovery? How to stay safe and healthy?
Yes. Post-recovery, what happens? Majority would have recovered very well, where they might just have a little bit of tiredness and weakness, maybe a little bit of bad appetite and loss of taste, which takes some time to get better. But a few of them, probably about 20-30% of them, they complain of extreme lethargy and tiredness. They say, doctor, I'm not even able to move out of my bed. So one of the reasons is any viral infection, after the infection is kind of waving off, the individual tends to have a little bit of tiredness and lethargy because the virus is releasing certain proteins which gets collected in your muscles and joints. So hydration is very important. Eating a nutritious food is very important. This lethargy is definitely going to get better, but there are going to be ups and downs in your energy levels. Today you might feel better. Tomorrow you might feel very low. Day after you feel like running, and the other day on the bed. So this ups and downs is definitely going to be there. And what you have to see is, 3 days ago, was I okay? Or am I better today when compared to what I was 3 days ago? And your answer will definitely be yes, I am better than what I was 3 days ago. So you will see that the improvement is happening, but it's taking some time. So all that I recommend is good nutritious meals, frequent meals, lots of water, hydration, and most important of all, exercise. Exercise, I mean breathing exercise, which is the top of all. And the second thing is to just take a stroll at home if you think you're extremely weak and tired. If you don't take a stroll, if you think, no, I'm very tired and you want to sleep on the bed all the time, that tiredness and lethargy is not because of the infection, but I would rather say it's laziness. So just start moving and eventually you'll see that you're getting better.
Thank you, doctor. Two types of vaccine, Covaxin and Covishield. So which one is better to take?
I think at the moment, take the vaccine that you get because you need some protection. Initially, we had only Covishield available in the private sectors, and then we had Covaxin only in the government sectors. But I would recommend you take any vaccine that you get. So we have seen that there is protection happening with both the vaccines. There is nothing in particular that you have to take only this vaccine. So you can take any vaccine that you get, no harm in it.
Thank you, doctor. What is the current state of pandemic? Can we foresee an end to this?
Well, I've been praying about it every day so that we have an end to this very soon. But the only way it's going to end soon is the way we stay away from it in terms of social distancing. So I have seen people around walking without the masks. I've seen people, sitting in the restaurants having a cup of coffee with 5 friends around without the masks. Well, that's not the way we need to handle this. It's time we stay back at home. Government is trying to do as much as possible to get us better. So the only way we need to do is just stay back at home if possible. The ones who are working from home, I think it's a blessing for you. Stay at home and avoid having close contacts with people who are infected, people who go to work and come back. At some point, which I would like to stress upon, people who go to work outside and come back home, please take a shower before you expose yourself to the elders at home, because your immune system would be great, so you would not get any infection. You would not show up any symptoms, but what is happening is you are a carrier of the virus and giving it to the elders in the family, and that's how the elders who are at home, who don't even step out of the house, are coming to us with infection. So when you get into the house, have a good shower and then get exposed to your family and the kids as well. And the second most important thing is, the moment you know that you have symptoms, please, please, please isolate yourself. Because if you don't isolate yourself, thinking that it's just a simple cold and cough, in that span of few hours, I do not know to how many members of the family you've already given the virus, because that's the most contagious period you are in, the first few days of your symptoms. So if you can isolate yourself at home, you are saving 3 or 4 others in the family by not giving them the infection. In that way, we reduce the numbers. And the ones who have medical problems like diabetes, blood pressure, and heart issues, the moment you get the symptoms, again, I'm telling you, 48 hours, please visit your doctor, because we have a category of treatment that we give for the ones who come with sickness, very sick and having medical issues. We give you the treatment very soon. We get all your blood tests done very soon, whereas for the youngsters, we wait at least for a day or two, thinking they will do much better. So, few points just to summarize. I want you to stay home as much as possible. Don't unnecessarily go out. Social distancing is the key here again. Wash your hands whenever possible. People who go out to work and come back home, please have a shower before you get exposed to your elders at home and the kids as well. And lastly, if you have symptoms, immediately report to your doctor at least 24 to 48 hours time.
Doctor, we have 2 more questions. Got this question now. So how long it will take a negative test for a COVID patient?
That's a very good question, a very common question I've been asked all the time. We never repeat your COVID test. Once you're down with the COVID infection, we never repeat the COVID test. Why? Because it takes few weeks to even months for the COVID test to become negative. The reason being, when we're doing a COVID test after you have recovered from the infection, the test picks up the virus, but does not pick the virus which is alive. So if definitely going to have a lot of dead virus, so it's going to tell you have a positive test, but that does not say you're infectious. So when you do a repeat test and you say, oh my God, my test is again positive, your stress levels are going up. The peace of the family is lost. You have sleepless nights. So I would recommend not to do the test at all. Now, the next question is definitely, pointing towards then how do I know I've recovered or not? How do I know I'm not infectious? After the first 10 to 12 days of your infection, your infectivity level is completely down. So after 12 days, you will not be spreading the infection to anyone else around you. And the other important thing is, if you want to know if you've recovered well or not, after 28 days of your symptoms, starting from the first day, after 28 days of your symptoms, you need to get a blood test called COVID-IgG antibody. If this is positive, then you have recovered. And if this is negative, maybe you didn't have COVID at all, because this has to be positive if you had a COVID infection. And higher the number, better is your immune system.
Thank you, JC. Thank you, doctor. So next, we have one more question. There's a talk going around that women with PCOS are more prone to COVID. Is it true?
PCOS is mostly seen in overweight females. So again, it comes back to obesity. So obesity is definitely a risk factor for COVID, and PCOS by itself is not a risk factor, but obesity, individuals with PCOS are prone to COVID infections more than the normal individuals. I think Pastor Abraham has a question for me.
I want to ask one question that I am as a survivor of COVID-19 now. Just got the information that I am negative, but I want to take the vaccination. How long I wait for eligible to take a vaccination?
Very good question, Pastor. First of all, congratulations that you fought this COVID battle and you're doing great. I'm very happy to hear that. So anyone who's recovered from a COVID infection, we ask you to wait for 6 to 8 weeks and then take your COVID vaccine. Why? Because the virus is still doing its work and your antibodies are still forming. So take a break of 6 to 8 weeks from the first day of symptom, and then you can take your vaccine.
Okay. Then one more thing I want to tell the people that don't wait for until it become more worse. If you got an opportunity, just approach the doctors and take the medicine. That's a better way. If you, in my experience, I go through all these things and this kind of antibiotic and WhatsApp treatment, everything, but still my infection was every day, it is 1,000 times it was increased. That's why if you go more and more worse, then you have to take more time to come back. So as much as early you can approach a doctor and find out a medical care, it is very important. It's very important in my experience.
Rightly said, Pastor. I always tell the patients, the sooner you get tested, the sooner is your recovery. The later you get tested, the later is your recovery.
Thank you, doctor. Good.
Thank you, Pastor.
Thank you, Pastor. Thank you, doctor. Thank you so much for this valuable time that you have given us today, explaining how we have to be cautious. And on behalf of PYP and IPC Bethel T Dasarahalli, I'd like to extend a warm thanks to you and your family. So for the end of this meeting, I would like to ask Pastor Abraham Matthew to please pray and close the meeting.
Praise Lord. എല്ലാവർക്കും ഒരിക്കൽ കൂടെ നന്ദി പറയുന്നു. ഡോക്ടർക്ക് പ്രത്യേകിച്ച് നന്ദി പറയുന്നു. ഇത് ഓർഗനൈസ് ചെയ്ത പ്രിയപ്പെട്ടവർക്കായി സ്തോത്രം. എന്താ കോവിഡിനെ കുറിച്ച് ഞങ്ങൾക്കൊന്നും അറിയില്ലേ എന്ന് ആളുകൾ ചോദിക്കും. പക്ഷെ നമ്മുടെ ഒത്തിരി ഡൗട്ടുകൾ എല്ലാവർക്കും ഉണ്ട്. നമുക്ക് ആകെ ലഭിക്കുന്ന ഇൻഫർമേഷൻസ് പറയുന്നത് വാട്സപ്പിലൂടെയോ ഫ്രണ്ട്സ് അയക്കുന്നതോ അല്ലെങ്കിൽ ഡെഡ്ലി പ്രശ്നങ്ങൾ മാത്രമേ നമ്മൾ അറിയുന്നുള്ളൂ. എന്നാൽ ഇപ്രകാരം ഒരു നല്ല ആശയം മുൻപോട്ട് വെച്ച PYPക്ക് ഞാൻ എൻ്റെ എല്ലാവിധ ആശംസകളും അറിയിക്കുന്നു. വളരെ ജെന്യുവിനായി വളരെ അറിഞ്ഞിരിക്കേണ്ട ധാരാളം ക്വസ്റ്റ്യൻസ് ആൻസർ ചെയ്യാനിടയായി. അതുപോലെ തന്നെ സിസ്റ്റർ മിജോ ചെയ്ത പ്രസന്റേഷൻ വളരെ നന്നായിരുന്നു. തുടർന്നും നമ്മളെല്ലാവരും അറിവിൽ തികഞ്ഞവരല്ല. ഇനിയും ലോട്ട് ഓഫ് തിങ്സ് വി ഹാവ് ടു ലേൺ. നമ്മൾ ഓരോ ദിവസവും പഠിക്കുകയാണ്. ഇപ്പോൾ ഉള്ള കോവിഡിന്റെ ഏറ്റവും വലിയ പ്രശ്നം കോവിഡ് നമ്മളെ ഇൻഫെക്ട് ചെയ്യുന്നതിന് ഒപ്പം തന്നെ നമുക്ക് ഹാർട്ട് ഫെയിലിയർ ഉണ്ടാക്കുന്നു എന്നുള്ളതാണ്. അതുകൊണ്ട് ഈ കോവിഡ് വന്നു ലങ്സിനെ അഫക്ട് ചെയ്തതെന്ന് മാത്രമല്ല ഹാർട്ടിനെ കൂടിയാണ് അത് അഫക്ട് ചെയ്യുന്നത്. അതുകൊണ്ടാണ് ഒത്തിരി ആളുകൾ ഹാർട്ട് അറ്റാക്ക് ആയിട്ട് പെട്ടെന്ന് മരിച്ചു പോകുന്നത്. ഈ വക കാര്യങ്ങൾ നമ്മൾ മനസ്സിലാക്കിയാൽ കുറച്ചുകൂടി നമ്മൾ കോൺഷ്യസ് ആയിട്ട് മെഡിക്കേഷൻസിനെ വിധേയരാകേണ്ടി വരും. പ്രാർത്ഥനയും വിശ്വാസവും നമുക്കുണ്ട്, അത് വളരെ ഇമ്പോർട്ടൻ്റ് ആണ്. അതുപോലെ തന്നെ വളരെ ഇമ്പോർട്ടൻ്റ് ആണ് പ്രോപ്പർ മെഡിക്കേഷൻ ലഭിക്കുക എന്ന് പറയുന്നത്. അതുകൊണ്ട് നിങ്ങൾ എല്ലാവരും ഒരിക്കലും ഇഗ്നോറൻസ്, ഞാൻ 2 പാരസെറ്റമോൾ കഴിച്ചു എൻ്റെ ചൂട് പോയി, അല്ലെങ്കിൽ എൻ്റെ കഫക്കെട്ട് ഇച്ചിരി കുറഞ്ഞിട്ടുണ്ട് എന്ന് പറഞ്ഞ് നിങ്ങൾ നാളെ ഇറങ്ങി ഓടരുത്. പ്ലീസ് വെയിറ്റ്, പ്ലീസ് വെയിറ്റ്, പ്ലീസ് വെയിറ്റ്. ദയവ് ചെയ്ത് നിങ്ങൾ വെയിറ്റ് ചെയ്യുക. തീർച്ചയായിട്ടും ദൈവം നമ്മളെ സൗഖ്യമാക്കും, സഹായിക്കും. ദൈവത്തിന്റെ കരം നമ്മളോട് കൂടെയുണ്ട്. പ്രാർത്ഥനയിൽ വീണ്ടും നമുക്ക് ഓർക്കാം. സൂസിക്ക് പ്രത്യേകമായി നന്ദി ഒരിക്കൽ കൂടെ പറയുന്നു. കർത്താവിനെയും അനുഗ്രഹിക്കുവാനാകട്ടെ. പരിശുദ്ധ പിതാവേ, ഞങ്ങൾക്ക് ഒന്നിച്ച് നൽകിയ കൂട്ടായ്മയ്ക്കായി സ്തോത്രം. ഇപ്രകാരം ഞങ്ങൾ കർത്താവ് PYPയുടെ COVID-19 അവയർനെസ് പ്രോഗ്രാമിൽ പങ്കെടുക്കുവാൻ, അനേക പുതിയ കാര്യങ്ങൾ കേൾക്കുവാൻ, അനേക കാര്യങ്ങൾ മനസ്സിലാക്കുവാൻ കർത്താവിനെയാക്കിയല്ലോ. അത് ഞങ്ങളുടെ സുരക്ഷിതയ്ക്കും ഞങ്ങളുടെ പ്രിയപ്പെട്ടവരുടെ സുരക്ഷിതയ്ക്കും ഞങ്ങളുടെ സഭയിലുള്ള ഉപമക്കളുടെ സുരക്ഷിതയ്ക്കും ഞങ്ങളുടെ ചുറ്റുപാടുകൾ പാർക്കുന്നവരുടെ സുരക്ഷയ്ക്ക് കാരണമാക്കണമേ. ഞങ്ങൾ ഈ ലോകത്ത് ജീവിക്കുമ്പോൾ ഞങ്ങൾക്ക് മറ്റുള്ളവരിൽ നിന്ന് വ്യത്യസ്തമായ ഇമ്മ്യൂണിറ്റി പവർ ഒന്നുമില്ല കർത്താവെ. സാധാരണ മനുഷ്യരാണ് ഞങ്ങൾക്കും കർത്താവെ ഏതു വൈറസും ബാധിക്കാൻ സാധ്യതകളുണ്ട്. എന്നാൽ കർത്താവെ ഞങ്ങളെ തന്നെ സൂക്ഷിക്കുന്നവരായി, ഞങ്ങളുടെ കുടുംബങ്ങളെ സൂക്ഷിക്കുന്നവരായും ഉത്തരവാദിത്തങ്ങൾ ചെയ്യുന്നവരായും കർത്താവെ ജീവിപ്പാൻ ഞങ്ങളെ സഹായിക്കണമെന്ന് പ്രാർത്ഥിക്കുന്നു. ഈ മീറ്റിംഗ് ഓർഗനൈസ് ചെയ്ത എല്ലാവർക്കായി സ്തോത്രം. ഞങ്ങൾക്ക് ക്ലാസ്സുകൾ നയിച്ച ഓർത്ത് പ്രാർത്ഥിക്കുന്നു. ആ പ്രിയ മകളെയും കർത്താവ് ധാരാളമായി സഹായിക്കണം. നൽകിയ നല്ല ഫെലോഷിപ്പിനായിട്ട് സ്തോത്രം. അവിടുത്തെ നാമത്തിൽ ഞങ്ങൾ കർത്താവെ ഇപ്പോൾ പിരിയുന്നു. ദൈവത്തിന്റെ കൃപ ഞങ്ങളുടെ മേലെല്ലാം ചൊരിയണമേ. മഹത്വം അങ്ങേക്ക് യേശു ക്രിസ്തുവിന്റെ നാമത്തിൽ തന്നെ. Praise the Lord. God bless you.
Thank you all for joining. Thank you, Dr. Suzi, once again. And God bless you all.